Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Tonight we are talking about watery and dry eyes. Express Care's Dr. Jitka Lom is here in studio, and now she's going to answer a few of our viewer questions. The first one we kind of touched on says, I wear contact lenses and my eyes get dry regularly. What can I do to prevent that? I guess not wear contact lenses?
That would be one. Make sure you don't wear them for too long, depending on your situation. Trying to take them out at nighttime, definitely try not to sleep with them, and give yourself a break on the weekends, or whenever you don't have to wear them, take them out.
Overall, are contacts bad for your eyes?
No, they're not. They're really a wonderful invention. It's really quite miraculous, really, that you can wear this tiny film over your cornea, but no, they're not long. They're so safe now because they are porous, but it's still something for your eye to get used to.
Okay. The next question says, I have sticky, watery eyes, but I have no allergies. What could be causing it?
Sometimes there's a low-grade infection on the actual eyelashes, and we call that blepharitis. And that means that there's just basically a low-grade overgrowth of bacteria right there at the lid line. Usually that's due to poor circulation of the tears, meaning poor flushing, and also sometimes it's due to the products. Again, ladies, make sure you clean your makeup, clean your brushes, throw out the mascara every couple months and start with a new one, sharpen your pencils, all that stuff. So that's one thing, but what you can do is actually get some baby shampoo or some Cetaphil, which is an extremely mild cleanser, and put it on a little Q-tip and wash your eyelashes with that a couple times a day, and that should really help.
Okay, wow, I've never heard that.
Yeah.
Why do my eyes get watery whenever I cut onions? Is there any way to prevent it?
Well, that's a great one. When you cut onions, sulfuric acid is released there, and it's volatile, meaning it's in a gas form. You obviously cannot see it. And the sulfur is very irritating to your eyes, so think volcano, sulfur, all that. And so to prevent it, so there's the home remedies of putting bread under your nose and all that. I think the easiest is just to wear goggles, swim goggles in your kitchen, really simple.
So you're getting ready to make stuff out and you're cutting onions with the goggles. My
cool.
Kids will love that one. All right, can you experience watery eyes and then excessive dry eyes? Is it possible to have both?
To oscillate? Yeah, sure, you could do that. Again, if it's you notice that there's something that you do and then you get the watery eyes in a certain environment, maybe in your office or bedroom if it's very dusty, or perhaps when you're exposed to certain chemical sprays or products, you're cleaning Febreze all over and you start to get wateries. Obviously, these are possibilities where you would alternate between dry eyes and wet eyes. But most of the time, your baseline then would be pretty dry.
Okay, our next question asks, can watery eyes be associated with certain diseases or ailments?
Watery eyes, yes, mostly with allergies, irritation, pink eye. I can't think of any other serious disease that would cause watering all the time, unless, of course, if you had a very unusual stroke, that could happen.
Yeah. What about dry eyes? Anything?
Dry eyes, just the Sjogren's disease that I was mentioning. That's all I can think of.
Okay. Are there any good home remedies for watery eyes?
Home remedies. Well, I guess we have Benadryl and Claritin, like I mentioned. Those aren't really home remedies. But there is a wonderful product called Optique, and that is a homeopathic herbal remedy. Again, they're drops, and it's very effective in helping people with any kind of eye irritation. It's not expensive and harmless. Absolutely impossible to be allergic to it.
Okay, and our last question asks, can watery eyes be hereditary?
I don't think so.
Okay. All right, and so, when do you know, or when should you go see an eye doctor? When do you realize that, okay, maybe this is something a little more serious and maybe I need to go see the eye doctor?
Sure. Well, I think if it's troubling you enough to the point where the tears are dripping, in elderly and young children, it's a big concern. In young babies, of course, sometimes there's a blockage of the lacrimal duct here. When they're born, it just doesn't drain right into that inner part of the eye. And they sometimes need to have a little minor surgery. What we do at the beginning with those babies is just massage here on the side of the nose several times a day, hoping that duct will open up and it'll drain the tears. But if not, then they put a tiny, tiny little tube right up in there and create like a little little canal for the tears to drain into. On the other hand, with elderly people, what can happen is that their lid doesn't quite close properly. It's a little droopy. We call that rheumy eyes, and they'll sort of have like a little drainage constantly down their cheek, and it can cause a lot of irritation. And again, that would be a surgical solution to that. So I think if the tears are interfering with your life in any way, then it's time to go see a specialist.
And then one last thing I wanted to touch on is just overall good health, good hygiene, I guess, for your eyes.
For your eyes.
It's always recommended to be washing your hands with soap and water, not to be touching your eyes. We teach that to our kids a lot. Anything else? Any other tips and advice that you have?
Well, just like you say, I mean, many teenagers, I have to say, forget to wash their eyes with soap and water. Using a mild soap would be very important, Dove or Ivory or something like that. And then I always tell children to keep their fingers away from their face unless they're eating or brushing their teeth, because when you start rubbing your eyes, that's when you start introducing infection and bacteria and chemicals.
Okay, sounds good. Well, thank you so much, Doc, and
My pleasure.
We look forward to seeing you again next week.
Yeah.
And we will you can check KUM.com for the topic for next week. Thank you again, Dr. Lom, for coming in, and we will pick up Healthy Living right after this. Stay with us.